Hello, I'm Anastasia, and this will be my final video. I'm going to have my camera woman do a quick sweep of the room. Okay, and we will begin.
Come in.
Hello, my name is Anastasia. I'll be your nurse for today. I'm going to do a quick head-to-toe assessment. This should take about 10 to 15 minutes. Any questions?
No.
Okay, I'm going to provide privacy, and can you confirm your name and date of birth?
Blake Eastwood, June 17, 2004.
Okay, just checking that against your wristband here. Now I'm going to wash my hands and then raise this bed to your working height. Now I have a couple of questions for you before we begin, all right? Do you know where you're at right now?
Yes, my house.
And why are you here?
Because I live here.
Okay, and what year is it?
2025.
Can you say your name one more time for me?
Blake Eastwood.
Okay. As you can see, the patient is alert and orientated ×4. They know where they're at. They know the situation, the year, and who they are. All right, and now we will begin. I'm gonna go ahead and touch your head and let me know if this hurts at all, right? No noticeable lumps or masses present. And now I'm gonna do the same thing to your neck very quickly. And no noticeable lumps or masses noted on my patient's neck. Now I'm gonna go ahead and assess your ears and your nose. And have you had any redness or drainage in the past?
No.
Okay, I'm gonna have you look over to that wall. Perfect, and then I'll have you look over to the door. Perfect, and then I'll have you just look up. Perfect. Okay, now I'm gonna go ahead and assess your eyes, and there was no redness or drainage noted with my patient's ears or nose. Pupils start out at about a 6. Okay. And I'm gonna shine this light into both of your eyes about 2 times, and it should not be painful. I'll just have you look straight ahead. Pupils constricted to about a 4, which is normal. Now what I'm going to have you do is I'm going to have you look straight ahead at your TV, and I'm going to bring this pen into your vision, and whenever I tell you to look, you'll look, okay?
Okay.
All right, and look. Perla is intact with my patient. Their pupils are reactive to light and accommodating. Now I'm going to have you pull down your eyelids like this. Sclera is white. You're good. Sclera is white and conjunctiva is pink. Now I'm going to have you do the same with your bottom lip. And the lips are appropriate for the ethnicity, and the buccal mucosa is moist. Now I'm going to assess my patient for JVD. And in a clinical setting, I'd have my patient at a 35 to 45 degree angle. And I'm going to have you look over to that wall. Oh. And then I'm going to have you look over to the door. No JVD noted bilaterally on my patient. Now I'm going to assess the carotid. The carotid pulse has regular rate and rhythm, and it is graded at a +2. Now I'm going to go on and assess your arms, all right?
Yeah.
Okay, just hold your arms out like that for me. Perfect. The skin color is appropriate for the ethnicity, and the skin is warm and dry and intact. Now I'll just have you flip over your arms like that for me. Now I'm gonna check out my patient's brachial pulse, and this will be on the ulnar side, on the pinky side. And I'm going to do the same on the radial pulse, and that will be on the radial side, on the thumb side. Perfect. And then both the radial and brachial pulse are graded at a +2, regular rate and rhythm. And while I was assessing that pulse, I was also looking at my client's respiration rate, and I counted for 30 seconds. And if you multiply that by 2, I would have my full respiration. I counted 17. I counted 7, and that would be 14 breaths per minute. All right, and now what I'm gonna do is I'm just gonna have you hold your hands out like that for me. I'm gonna assess capillary refill here. Capillary refill is brisk in less than 2 seconds bilaterally. Now what I'm gonna have you do is I'm gonna hold my fingers out like this, and I'll just have you squeeze them as tight as you can, all right?
Okay. We're both?
Yep.
Okay, squeeze.
Yep. Perfect. Okay. Now I'm going to hold my hands like this, and you're going to push up with your hands.
Okay.
Push up. Okay. And now you're going to push down with your hands, all right?
Yeah.
Okay. As you can see, my patient's musculoskeletal strength is +5, as well as their grip strength. And now I'm going to check for any breakdown. doing so on the bony prominences, so the elbow, the wrist, and the hands, and there is no skin breakdown noted. The skin is intact. And now I'm going to go ahead and listen to my patient's heart, and there are 5 different spots you do this in, and a good mnemonic for that is 8 to men. So your aortic is going to be on the right sternal border at the second intercostal space, and then your pulmonic will be on the left sternal border at the second intercostal space, and then Erb's point is going to be the left intercostal space, the left sternal border at the third intercostal space, and then tricuspid will be at the fourth intercostal space, and that will be on the left sternal border, and then your mitral will be at the fifth intercostal space, and that will be the mid-clavicular line. That is also where I will be counting the apical pulse for a full minute. All right, and now we will begin. Okay, the heart is regular rate and rhythm, and the apical pulse was counted at 63 beats per minute. And I would also like to mention here that the S2 sounds are going to be heard best at the base, which is up here, and then the S1 sounds will be heard best at the apex, which will be down here. Now I'm going to have you sit all the way up, and I'm going to have you swing your legs over to me.
Okay. Like this?
Yeah.
Okay. Sweep this.
Can you scoop like toward me?
Yeah.
Perfect.
Good.
Yeah. I'm going to test for symmetrical expansion here. I'm just going to have you take a breath in and out. Perfect. Symmetrical expansion is noted bilaterally, anteriorly. And now I'm going to listen to your lungs. There will be 5 spots on each side, totaling of 10 on the anterior side of the body. And just take a deep breath in for me. All right. No adventitious lung sounds noted during auscultation bilaterally, anteriorly, and the lungs are also clear to auscultation. Now I'm going to have you swing around, and you're just going to face the wall for me. Okay. And I'm just going to do the same thing back here. Take a breath in. And out. Perfect. Symmetrical expansion is equal bilaterally, posteriorly. Now I'm going to listen to your lung sounds posteriorly, and there are going to be 18 spots, so I will be listening for a while, but nothing is wrong. Okay, take a breath in. Perfect. Posteriorly, the lungs are clear to auscultation and no adventitious lung sounds were noted. And I did listen for a full expiration and inhalation here. Now I'm just gonna have you lay back down again. Actually, no, wait. While I'm here, I'm gonna check for any skin breakdown back here. Shoulders are intact, hips are intact, back is intact, and then the sacrum is also intact. Okay, you can lay back down now. Okay, and now I'm going to listen to your abdomen here. So I'll have you lay down a little bit more.
Okay. This is good?
Yeah, that's good.
Okay.
And then I'm gonna start in the right lower quadrant and work my way around in a clockwise motion. All right, the bowel sounds are normal active in all 4 quadrants. And now I'm going to perform light palpation. Have you had any pain or tenderness lately in your abdomen?
No.
Okay. And again, I'm going to start in the right lower quadrant and I'm going to go in a clockwise motion and zigzag it. Let me know if this hurts at all. Abdomen is soft and non-tender to palpation, and now I'm going to move on to assessing the lower limbs, all right?
Okay.
Just gonna take you out of this blanket here. Okay, the skin color is appropriate for ethnicity. I'm just gonna, and the skin is warm and dry down here, and now I'm gonna assess the PT pulse, which will be right behind the heel. Perfect. And now I'm going to assess the dorsalis pedis, which will be on the top of the foot, but this is in a different location for everybody. Okay. The dorsalis pedis and the tibialis posterior pulse are both +2, and they are regular rate and rhythm. Now I'm going to check for cap refill here. Capillary refill is brisk, less than 2 seconds. Now what I'm going to switch spots with you really quickly. Okay, now what I'm going to have you do is you're just going to push down on my hands like you're driving a car, okay?
Okay.
And push down. Then I'm going to have you push up towards your nose. Perfect. And now I'm going to pick up both of your legs and fold your knees in. And then you're going to push down as hard as you can. Perfect. Okay. The musculoskeletal strength of the lower extremities is +5. And then there is no swelling noted. And I'm just checking for edema here really quickly. No edema noted as well. And I'm going to check for skin breakdown on the heels, ankles, and the knees and the back of the knees as well. Okay. No skin breakdown noted. All right. And that is all I have for you today. Do you have any questions? Okay.
Nope.
I'm going to make sure my patient has their call light in place, make sure they have their non-skid socks on, raise the bed to a lower height, and put up bed rails ×2. I'm going to wash my hands, and that is all. Thank you.